CTO means a blockage of the heart vessel, which usually have three major vessels on the surface of the heart. So if the atherosclerosis, so-called plaque, build up in the one of the vessels, it will occlude. But over time, sometimes people don't develop the heart attack without developing those disease. So if you have those kind of the blockage of the heart vessel, usually the choice of the treatment would be either medication or the bypass surgery. Bypass means open heart surgery, or just the angioplasty. Angioplasty is a percutaneous catheter approach. But in the past, since blockage of the heart, we cannot see the distal part clearly. So the procedure-wise, it's very difficult to do the angioplasty over this occluded segment, not to mention putting some balloon or the wire to the distal target segment. And so that it's a development of the history over these 20 years that we have a gradually improvement of the success rate from the initial 50% up to the 90% in the recent days. Irrespective of the proximal part of the morphology, proximal means that if some artery has a blockage or the narrowing, but the bypass means a real bypass, so it can connect that some blood vessel over this occluded segment to the normal segment. So the bypass has some advantage. But some disadvantage is, of course, the bypass is a major surgery, so sometimes that it will take days for the recovery, and sometimes higher propensity for some cerebral stroke. Those are the disadvantages. The surgery takes several hours to have the procedure completed, but the angioplasty, sometimes we perform just in an hour to complete the procedure, but sometimes when a severe blockage with a lot of calcium, for example, calcium means a lot of bony hard region there, then we may end up with a 4-hour procedure, so it's a very much wide range. Yes, but the bypass surgery is so-called if they can use the arterial graft, that is one of the internal mammary artery, one of the artery coming from the chest and connected to the distal heart vessel, then it can last more than several years. That is the disadvantage. And the major disadvantage of angioplasty is so-called restenosis. Narrowing can occur just about 20 or 30% after the first procedure done in the past. But when it comes to the recent procedure, which is performed by the drug-eluting stent or the bioobservable stent, those number of restenosis at 6 months will reduce down to the 5 or 3%. So that is a major progress.